Good morning, all. Today we are going to discuss an interesting topic in healthcare and data science. The topic is generating synthetic data for healthcare. So, in modern hospitals and medical researches, a large amount of data of a patient record, like test results, medical records, and treatment histories are there. So they have collected in a data format. So in this data, it is extremely valuable for developing new medicines and improving the diagnosis system and training the artificial intelligence model. So however, using these real patient data comes with the serious challenges. So patient information is private and protected by strict privacy laws. So in hospitals, it cannot be easily shared in a real patient records with researchers. So because it may expose the sensitive personal information. So to solve this problem, researchers have introduced the concept of synthetic data, which is synthetic data is an artificial data that is generated using advanced algorithm and machine learning models. So in today's role play, we will explore how synthetic data is generated, how it helps the doctors and researchers, and what are all the challenges exist while using it in healthcare. So through this discussion, we will understand how data science and artificial intelligence are transforming the healthcare industry.
Every day in hospitals, we collect a huge amount of patient data, medical history, lab reports, scan results, and treatment outcomes. This data is extremely valuable. It helps us understand diseases better and improve treatments. But there is a major problem. This data is also highly sensitive. It contains personal information about patients, their identity, health conditions, and even lifestyle habits. Because of strict privacy, regulations, and ethical concerns, we cannot easily share this data with researchers or technology companies. Even within hospitals, access is limited. Let me give you a simple example. Suppose research team wants to develop an AI model to detect cancer at an early stage. For that, they need thousands or even millions of patient records. But hospitals hesitate to share this data because even a small data leak can create serious consequences. Patients might face discrimination, loss of job opportunities, or emotional distress if their medical details become public. So we are stuck in a difficult situation. On one side, we want innovation, but and better healthcare solutions. On the other side, we must protect patient privacy at all cost. This creates a gap between data availability and data accessibility, and unless we solve this problem, progress in
Doctor, I completely understand what you are saying, but from a patient's perspective, this is really scary. When I visit a hospital, I trust that my information will remain private. I share everything honestly, my symptoms, my past illness, even personal habits, because I believe it help me get better treatment. But if that some data is shared somewhere else without my control, it feels like a violation of my trust. For example, what if my health condition becomes known to my workplace? Or what if insurance companies use my data against me? These are the real fears that many patients have. At the same time, I also want better healthcare in the future. I want diseases to be detected early. I want faster treatments and better medicines. And I know that all of this is possible only if researchers have access to data. So I feel confused.
Thank you both for sharing your perspectives. This clearly insights a very important challenge in healthcare. Let me summarize what we are facing. Patients need privacy, trust, and control over their data. Doctors and researchers need large data set for innovation. Hospitals need to follow strict legal and ethical guidelines. So the real problem is not just about data. It is about balancing privacy and innovation. In design thinking terms, we can frame the problem like this. How might we enable healthcare research using patient data while ensuring complete privacy and security? This is not a simple technical problem. It's also emotional and ethical. We must design a solution that people can trust. We need something that protects patient identity, allows data sharing, supports research and AI development, and builds confidence among all stakeholders. Now the question is, what kind of solution can we achieve all this?
I think we can solve this using something called synthetic data. So synthetic data is artificially generated data that mimics real patients' data but does not belong to any real individuals. For example, instead of using Ravi's actual medical record, we generate a fake data set that has similar patterns. It looks like real, behaves real, but contains no personal identity. We can use technologies like AI models, machine learning algorithm, generative models. So these tools learn from real data and create safe, anonymous data set. So this means researchers can train models, test treatments and innovative without risking anyone's privacy.